Hi, class and Dr. Marco. This is my project on the educational program for use of telenursing tools on the virtual urgent care platform. The mission at NYU Langone Hospital is to serve, teach, and discover. The vision at NYU Langone Hospital is to make world-class contributions that place service to human health at the center of an academic culture devoted to excellence in research, patient care, and education. The project aligns with the organization's mission, vision, and priorities with improvement in patient-centered care and advancements in technology. Issues faced by the organization for improvement include gaps in technology access, data accuracy, patient privacy, patient confidentiality, clinician resistance to change, and improvement in documentation for nurses. Why is there a need for telenursing? There's currently a lack of telenursing services in the organization. If patients have the option to connect with nurses on the virtual urgent care platform, then there can be improvement in patient education, preventative care, and patient outcomes. Telenursing on the virtual urgent care platform will allow nurses to assess patient needs and symptoms, prioritize urgency of patient needs, provide instructions and education for patients, and evaluate patient outcomes. It will improve patient outcomes, patient satisfaction by providing education, delivering patient results, and recommending referrals for other services and symptom triage. The intended purpose of the educational program for use of telenursing tools on the virtual urgent care platform is to provide training for nurses on effective and efficient use. Increase in knowledge allows nurses to provide high quality care and educate patients. The intended change was triggered by nurse managers who have access to patient satisfaction scores on virtual urgent care services. With improvement in patient-centered care, patients will be more pleased with services provided. This leads to improvement in patient satisfaction scores. The goal of the project is to use telenursing tools on the virtual urgent care platform to improve patient satisfaction scores and outcomes by providing education for nurses. The educational program consists of guidelines and tip sheets to educate nurses. Nurses will be able to provide telenursing services for patients following these guidelines and tip sheets on appropriate use of services and documentation. Improving documentation on electronic health records and telehealth leads to improvement in patient outcomes. The project is implemented at NYU Langone Health Virtual Urgent Care. It serves patients that need virtual urgent care services. Nurses that will be providing telenursing services will complete the educational program for training. The stakeholders involved in the project consist of nurses, the Nursing Education Department, Quality Improvement Department, Information Technology Department, and patients. The team members for the project implementation will include the project manager, the nurse educator, quality nurse specialist, informatics nurse specialist, and the epic specialist. An educational program consisting of guidelines and tip sheets are developed to train nurses on the use of telenursing tools on the virtual urgent care platform. The following guidelines include a clinician connecting to video visit from Epic tip sheet, guidelines for video visit documentation, patients accessing MyChart video visit tip sheet, patients accessing video visit link tip sheet, and telenursing patient scheduling tip sheet. The measurement tools created include a pre-assessment survey, a nurse post-assessment survey, patient satisfaction survey, and the chart audit tool for documentation. The evaluation methods are significant for measuring the successful implementation of the project and achieving the project goals. The nurse assessment survey is important for measuring the knowledge of using telenursing services before completing the training program. It shows the project team the areas that need to be focused on for improvement. The nurse post-assessment survey is important for measuring the knowledge of using telenursing services after completing the training. It shows the project team if the training was effective in improving knowledge. Gathering patient satisfaction surveys post-telenursing encounter will determine if services provided have made improvements in patient satisfaction with the virtual urgent care. Chart audits are completed by managers to evaluate if telenursing documentation is complete and accurate to improve collaborative care and patient outcomes. Many of the nurses that participated in the survey, shown by the gray-colored bar, expressed that they disagreed with many questions regarding the telenursing services. Nurses felt that they did not have an adequate amount of education to provide the telenursing services to patients prior to the training program. Many of the nurses that participated in the survey, shown by the navy-colored bar, shows that nurse comfort levels increased post-implementation of the project. When nurses are comfortable using new technology, they are better equipped to instruct patients on how to use new technology as well. This leads to an increase in patient satisfaction and patient outcomes. Nurses work more efficiently, improve teamwork, and provide standardization in nursing care. Efficient workflow results in the improvement of communication and the coordination of care. Based on the results of the patient satisfaction survey, patient satisfaction levels increased with the addition of telenursing services to the platform shown by the yellow-colored bar. Patients were pleased with nursing care provided and would recommend telenursing services to their family and friends. Patients were satisfied with education provided during the telenursing encounters. Based on the results of the tri-audits, documentation improved with complete and accurate data shown by the green-colored bar. Complete and consistent documentation is important for providing patients with safe and quality care, ensuring accurate reimbursement for services, mitigating risks, and planning and maintaining collaborative care between healthcare teams. When patients are provided with a complete plan of care and treatment, they can be empowered to take control of their own health care. Many organizations do not have formal training related to telehealth and are expected to obtain necessary training on the job. The project shows that training programs ensure that nurses have the appropriate and complete knowledge and skills to perform their roles and responsibilities. When nurses feel comfortable using the telenursing services and tools and the virtual urgent care platform, they provide better education and instructions for patients on the appropriate use. Patients that feel comfortable using the virtual urgent care platform will also be more satisfied with services. With the inclusion of the guidelines for the appropriate telenursing documentation, nursing workflow improved with complete and accurate data capture. The Nursing Education Department developed content for training and information that will be included in guidelines and tip sheets. The Quality Improvement Department monitors and analyzes project performance. The Information Technology Department develops the electronic template for telenursing tools on the virtual urgent care platform and provides technical support for the end users. Nurses provide input for improvement of content in the training program. Nursing feedback is also important for developing a user-friendly electronic template for telenursing. Interprofessional collaboration is essential for ensuring all aspects of the project are complete for success. If different electronic health records, also EHRs, are being used, the program will have to be altered for the appropriate EHR that's being used by the organization. The training can benefit from adding video modules to reinforce important points of the program. Updates will need to be incorporated in the educational program to keep up with changes in healthcare for the future. These updates will be incorporated in refresher online modules that nurses must complete annually. Nurses can also benefit from simulation activities and clinical telehealth rotations with experienced telehealth providers. I appreciate the time you have taken to view my presentation. Any feedback and questions are appreciated. Thank you.